Hi, good afternoon. Happy Monday, June the 28th, coming live from downtown Boston. Happy Monday. This is the Queen Battle, a battle for aid responder services, a first aid and a first aid responder service, a first aid safety service here and defender for the city of Boston, as well as being here on the streets in Boston, as well as a traveling medical assistant. I'm very much happy to be here and very much happy to go out there and uh, use my resources and availability as needed to help out the community. So I'm very much happy to be here. Today is Monday, June 28th, coming live from beautiful 90 to 85, 90 degrees here on Monday afternoon. It is 3:15 here in the city of Boston. So I want to give a shout out to all my supporters, family, friends, and associates on Facebook, Instagram, YouTube, LinkedIn, and all around the world. So thank you so much for your support and appreciation. I really do appreciate it coming here from Massachusetts to New York to Texas to Florida to California and Atlanta and all around the world. This is La Queen Battle. I'm very much happy to be here. Happy Pride. This past Sunday was Pride Parade was all around the United States here. Then we have the Pride Parade in New York, as well as Pride Festivals, Pride Block Party here in Boston, and all around the United States. I'm very much happy to have celebrated that with a lot of young people. I know that there are people that continue to go out there fighting for the rights of the rainbow LGBTQ community all around the world. So I'm very much happy to have been involved in that and a part of that, as well as celebrated Pride in New York, celebrated Pride in Chicago, and different cities and festivities. So again, shout out to all my friends and family and associates. Happy Pride, as well as going out there to also go ahead and give you guys a couple of stats on COVID-19 here in the state of Massachusetts. I'm going to go ahead and go over a couple quick COVID stats. As you know, today it is for Sunday, June the 27th. There have been 31 new confirmed cases, 663,625 total confirmed cases, 1,432 active COVID-19 cases. The largest, as you know, as I spoke about in my last podcast. I'll make this a quick podcast today because you can also join me on Facebook Live there too as well. But the largest confirmed COVID-19 cases have been in populations aged 20 to 29 years old for young college student adults. As you know, summer's here. A lot of people are on summer break, summer recess, and out there going to the beaches, partying, having a good time, enjoying time away from school, enjoying time, just some free time in their lives and their families. So the largest confirmed positive cases was in ages 20 to 29 for here in the state of Massachusetts, as well as in different parts of the city. But there was a total confirmed cases of 244 cases for ages 20 to 29, as well as for ages 30 to 39. There was a total of 176 positive confirmed COVID-19 cases. So again, I want to encourage you, young people out there, to continue to get tested for COVID-19. There are plenty of facilities out there, CVS, Walgreens, the Department of Public Health, local community agencies. I know that CIC was a really big agency organization here, CIC Health. I want to go ahead and send a congratulations to them for their support with the Gillette Stadium here in Boston, as well as working at the Heinz Convention Center, doing millions and millions of COVID vaccinations here. But there are plenty here in Boston, as well as Massachusetts, but there are plenty of organizations out there and agencies for you to get tested for COVID-19, as well as to continue to get vaccinated. So for your young adults at their ages, for your young college students adults, as well as young working adults, please continue to get tested for COVID-19. Please continue to get tested for COVID-19. There was one confirmed death reported total as of yesterday, Sunday, June the 27th, in Massachusetts, which brings the total to 17,626 in the state of Massachusetts in total. And that's what happens. That's a report from Massachusetts. And for New York, the total confirmed cases is 137, and the daily average positive COVID-19 cases, which brings that to 158,016 hospitalizations in New York. I'm looking up here, and I'm looking at the stats from the New York Times as well as the CDC, which is what I'm getting a lot of these stats from, as well as checking on the New York Times here. There was, let me see here. Confirmed total reported of 947,310 positive cases in the city of New York. Deaths were bringing that down to 30,156 confirmed deaths in New York and the state of New York. There were 10 new coronavirus deaths and 466 new cases reported in New York City as of May the 25th, which brings that the decrease of 47% from the average of 2 weeks earlier. This was reported on May the 25th. As of that was on May the 25th, and as of June the 28th, that brings that total confirmed cases, to 320, which has seen a decreased drop in COVID cases, as well as coronavirus testing, which brings it to 70,168 confirmed total tests, hospitalized, which is 830, a confirmed total deaths of 10, and now vaccinations has increased dramatically, brings all ages to 53%. Total vaccinations, ages 18 and up, 64% has increased dramatically, as well as to 65 years old and fully vaccinated, which brings it to 78% fully vaccinated in ages 65 and up. So as you know, which is great, New York has met its vaccination goal, which is great. So I'm going to go ahead and send congratulations to New York, as well as here in Massachusetts, we have met our vaccination goal, which is great for sites like Hyatt Convention Center, as well as the Gillette Stadium not closing, which is great. Again, I'm very happy about that. The state of emergency has been lifted in Massachusetts as well as New York. We still have a lot to do. President Biden, current administration and staff still has not met his July goals for reaching for his total people to be vaccinated. I'm looking at here. Goals. Let's see here. So, according to CNBC deadline, President Biden wants to at least meet by July the 4th. He wants to at least have at least 70% of the total American population to receive at least one vaccine or more. But he's kind of short of that population, as according to a CNBC article dated on last Tuesday, June the 22nd, and said that the Biden administration said Tuesday that it likely won't hit President Joe Biden's goal of getting 70% of Americans adults to receive one vaccine shot or more by the 4th of July holiday. Jeff Zients, White House COVID czar, said that the administration has met its 70% target for people ages 30 and older, and is on track to hit it for those 27 and older. But it says that U.S. officials are still working with state and local leaders to reach even more younger people. They think it will take about at least a couple extra weeks to meet the 70% of all adults with at least one shot in for those ages 18 to 26. And like I was saying before, in my last podcast last week, as in today on my Facebook podcast, the COVID positivity rate for those testing positive for COVID-19 is highest in ages 20 to 29. So like I said before, they're trying to get more young people vaccinated at the same time, trying to bring that positivity rate down for more younger people. Okay, so again, younger people, 20 to 29, is the highest cases of COVID-19 positivity rates in the state of Massachusetts as well. And try to get more young people vaccinated for President Biden to go ahead and reach those goals that he's trying to meet. Which I know I'm kind of going back in a little circle, but that's what he's trying to do. Again, to bring this pandemic to an end, hopefully within the next 12 months. Again, the pandemic is not over for a lot of people. A lot of people around the United States, as well as those around the world. We're still dealing with the economy. We're still dealing with schools opening. We're still dealing with businesses closing down. We're still doing people losing their unemployment, as well as the pandemic. The pandemic eviction moratorium ending, and they're now trying to extend that to as well. So the total COVID-19 pandemic may be over. The state of emergency may still be lifted in several states. Here in Massachusetts, it's over, as well as in New York. But at the same time, as Massachusetts, New York, different states are in their final phases of reopening, phase 4, final phases of business reopening, stadiums, sports arenas reopening. We still have a lot to do to bring the United States up out of this pandemic. We still have a lot to do, and I'm glad to be a part of the volunteers out there, the community volunteers out there, just talking to you, the public, here on social media, as well as talking to the public in general, going out there and say that we still have a lot to do in the community, and we still have to advocate for those going out there and trying to reach the goals that the current administration in office, as well as the different people in every single state and region, have to meet their goals. Right now, a lot of administrators, government officials have met their target goals. It's great. The economy is coming back to motion. Tourists are coming back into the city. That's great. Businesses are now reopening. Restaurants are now reopening. That's great. At the same time, we still need to bring it back into focus. Okay, we still need to have people still need to get assistance for rental assistance, to get some kind of economic assistance. As you know, we have passed several different stimulus bills have been passed in order to help people to lift them out of the burden that this pandemic has caused. So even though there has been several stimulus packages that have been passed, people at the same time still have to bear the burdens of dealing with a great financial burden, okay, dealing with how the pandemic has brought them out of this pandemic, okay? So people still have to deal with that. With evictions, looking for jobs. The unemployment is now ending in several different states all around the world, and that is still what people have to deal with. At the same time, we start to focus on what the current administration wants in office and what we have to do to bring this economy back into focus. There still has a lot to be done, and I'm great to be, like I said before, I'm great to be a part of a community advocate, working out there, talking to people, and making sure that it's done in the community. Again, there is I'm here on this YouTube platform speaking to you guys here, and it's great to be here in Boston. Again, we still have a lot to advocate for and report. COVID is still not over for a lot of countries, as well as in South America, as well as in India, as well as in regions in the Middle East. There are still countries that need America and that need the vaccines that are in development here in the city of Massachusetts, New York, as well as all across in California. Several different cities have the vaccinations in to reach, and they need the resources that America has to reach out to them. And so it's great that President Biden has agreed to send out over 10 million, 20 million vaccination doses to countries out there that are in need of the resources that America has. So that's great that President Biden is doing, but at the same time, we have to learn how to take care of ourselves and our economy, as well as to go out there and making sure that we can help other people in other countries in need. Okay, so that's great. That's great that President Biden has agreed to help out other countries, which is good. He's trying to reach his goals. He has still a lot to do. Right now, the vaccine is available for young children ages 12 to 17 years old. It's still not available for those under 9 years old as of yet, but it still is available for young children, which is good. I know that they have the Johnson & Johnson vaccine. They're still agreeing on that, whether it's available for children as yet. But let me look at here. They're still doing clinical trials to see if it's available for children 9 years old and under. Um, right now, according to when will the COVID-19 vaccines be available for children under 12? With the healthline.com article, they said that experts expect that a COVID-19 vaccination for children ages under 12 could be available by September or October. They're still doing clinical trials are underway to test vaccines in younger children. And they said experts say that it's important to vaccinate children of all ages to achieve herd immunity in the United States. And they said that it depends on what age and what vaccine is available in your area. Last week, this article was published on May the 20th, according to Healthline.com, and it said that the Food and Drug Administration expanded its emergency use authorization for the Pfizer vaccine to include children ages 12 through 16 years old. Meanwhile, like I said before, they're still doing clinical trials are underway to test the safety and the efficacy of COVID-19 vaccines in children under 12 years old. So the studies are still in progress, but they're still trying to do it and make sure that they meet that target by September or October for children 12 and under. So again, we're still trying to meet herd immunity. Herd immunity has not yet been met by President Joe Biden and his team. So, but we still have a lot to do. So herd immunity goals has still not been met. Put it right here. So herd immunity goals still has not yet been met. We are still trying to focus right now. As you know, he's trying to meet his goal of vaccinating over the current total of at least 70% of the total American population by the July 4th deadline. We still have a lot to do, and right now, as a person here in the community, we're still working on those goals. Okay, now I am just a first aid responder. I'm just a nonprofit here in Boston, but what I am is I'm bouncing back and forth on what I see in the news and what I see on local administrators, what I see in the news versus what the CDC is saying, as well as versus what the current administrative office is saying, and how does that apply to me and my family, as well as how does it apply to you and your family. I know for those of you out there who are on my YouTube platform, as well as all my other social media platforms, can agree with me and just say, look, we agree with you. But at the same time, some people, like I've had a conversation with a young lady this past weekend, and at the airport, she was saying, like, well, I don't agree with the vaccine. I don't agree with it because I've had a lot of bad opinions from doctors and doctors' opinions saying that, that it's good to be vaccinated. At the same time, though, I, for my own personal opinion, I know what's best for me and my family, and we don't want to be vaccinated. Or some families from different regions of the United States, especially in cities like in the southern hemisphere. This is one lady who was from Florida. She was pretty much saying, "I don't agree with the vaccine. I don't agree with it. I know what's best for me, but what's best for me and my body, and I've gone through." She would say she was going through hormonal treatment. She had heart problems. She had a former heart bypass, and she didn't want the vaccine to try to cause any other further issues with the other prior existing conditions that she already had with her previous health conditions. Okay, so for those of you with prior existing conditions, such as any cardio conditions, as any previous heart conditions, as well as those who are diabetic, as well as those who are going through any kind of cancer treatment, I would still consult with your physician or your local doctor to say if the COVID-19 vaccine, whoever it is administered by, Pfizer, Moderna, Johnson & Johnson, whoever it is administered by, whether the vaccine is safe for you and your family. I would still consult with your doctor, your primary doctor first, and whether to see It is, of course, your personal decision. It is your personal best advice. Seek the advice of your clinician, as well as get a second opinion on what you want to do. Okay. Now there are still people out there who have not gotten the vaccine, as well as who have not gotten tested for COVID-19. Still, I would encourage you to talk with your primary care doctor, or to talk with any kind of health practitioner. It doesn't necessarily have to be a medical clinician, but talk with a healthcare practitioner and making sure that you and your family receive the best advice of whether you still want to you want to receive the COVID-19 vaccine. Consult with a practitioner about that, okay? A lot of people, as I've met, I have family and friends who are still debating about it. I have family friends from Texas. I have family friends from Florida. I have family friends from California, as well as it's not necessarily a political or religious opinion. It's just your own personal decision of what you want to get the vaccine or not. Still have family friends who decline to get the vaccine. I completely understand that, but still, like I said before, I would consult with your local primary care doctor on what's best for you and your body and your own personal healthcare needs, as well as what's best for you and your family. Go out there and do what you can, what's best for you and your family. Okay. So that's my whole issue with the COVID vaccine. I've been vaccinated. I received the vaccine. I made the personal decision to say, okay, I've consulted with the local news outlets. I consulted with the CDC, as well as with the FDA. I consulted with my own personal doctor. I made the decision was best for me, and my personal decision was to get the vaccine, and I got the Moderna shot. Now, um, it's a like I said before, it's according to your own personal decision. Okay, that's fine. As you know, we have plenty of political leaders out there saying in public, we're going to get the vaccine. Support them, support your local leaders. Again, make a decision of what's best for you and your family. Okay. Now, like I said before, the COVID-19 vaccination rate is most positive right now in young adults ages 20 to 29. As of last week on June the 23rd, I had a podcast on Facebook where I said the most reported COVID-19 cases were in the ages 20 to 29, as well as today on the stats for the CDC for the state of Massachusetts, as well as in New York. The total most positive COVID-19 cases were in those ages 20 to 29, as well as in 30 to 39. Please, young people, go out there, continue to get tested for COVID-19. Do what's best for you and your family, as well as those in nursing homes, those adults ages 65 and older. Do what's best for you and your family. Continue to get tested for COVID-19. Get vaccinated. Take care of your own personal health, your own prior existing conditions. Take care of those issues primarily. At the same time, know what's best for you and your body, and make sure that those issues are addressed primarily and foremost. Okay, dealing with the older population, you deal with diabetes, you deal with hypertension, you deal with other pre-existing conditions, respiratory distress, respiratory problems, influenza. A lot of adults, primarily ages 65 and older, they make it mandatory for them to get the flu vaccine, but it's not necessarily mandatory for them to get the COVID-19 vaccine. Okay, still, for those in nursing homes, as well as adults living independently and on their own, please talk with you and consult with your local physician. For those adults, older adults, elderly adults, ages 65 and older, consult with your family, as well as your local practitioner of what's best for you and this COVID vaccine. Okay? All right, so this is LaQueen Battle about the first aid responder services. The pandemic is still not over. I know I'm talking about this, but I love to be a helpmeet. I love to go out there and help out the community, as well as go out there and do what's best for the community. I love that. That's something that I love to do. I love to be a part of. There was an issue this past weekend at Boston Airport. There was a big rainstorm. I reported it. They had water leakage and water damage at the airport. I reported it. Public safety took care of the issue. It's addressed. That's great. That's something I do on the side, as well as any kind of first aid issues on the street. I've been in New York, I've been in Boston. Boston police pretty much knows me as well as other issues I'm going through. I love to be a part of the community and I love to help other people. And that's the resources. That's the thing that I love to do. If you would like to donate to my nonprofit, my 501c3 nonprofit, Vital First Aid Responder Services, please donate. Send cash donations of $1, $5, $20 to a Cash App, Venmo, or PayPal to Vital First Aid Responder Services at Cash App, Venmo, or PayPal, but it's just the name is Battle First Aid Responder Services. So I would appreciate cash donations. You can see donations to Cash App, Venmo, or PayPal at Battle First Aid Responder Services. I really appreciate you guys. Thank you so much for your time. Happy Pride. Happy Pride. It's a time of celebration for those of you out there. Also, I'm going to say disclaimer, mental health is still a very big issue for people out there still dealing with the pandemic. Mental health. For those of you who are going through any kind of stress, anxiety issues, please reach out to family supporters as well as try to get therapy and counseling. It's not a shame to get in therapy, but try to reach out to those of you who are your loved ones and those of you best in need. Try to get the resources that you out there. There are people who want to help you. There are people who want to be of resource and of value to your life. If you can't get the help that you need, try to get the help you need somewhere else. But please get help. Get help and do what's best for you and your for you and your loved ones. If you are needing any kind of assistance, if you're any kind of going through any kind of feelings of isolation or feelings of suicide, please reach out to the National Suicide Hotline at 1-800-SUICIDE or call 911 for assistance if you're dealing with any kind of suicide ideation as well. Okay. As well as, again, it's Pride. I would encourage all my young people out there, as well as in the rainbow community, to go ahead and get tested for HIV and AIDS. HIV and the AIDS epidemic is still one of the highest epidemics killing young people and adults all around the world. I will still encourage you to go out there and get tested for HIV and AIDS. Please get tested. Get tested. Stop HIV. Stop AIDS. The hashtag is still stop AIDS. Okay, stop HIV. Okay, that's still the hashtag. That's still the hashtag. So that's still the hashtag. Stop HIV. It's still the hashtag. So I'm gonna put it right here. I think it's the hashtags in AIDS. Okay, all right, so this is a Queen Battle First Aid Responder Services coming live from Simple Studio here in downtown Boston by Boston City Hall. I would really appreciate you guys. I love you. If you support what I do, if you are a follower, if you are a friend, if I mention different events all across the United States, thank you so much for your time. Appreciation. I would encourage you guys. I'm having an event and I'm going to be a part of the event. It's going to be July the 5th at Boston Commons in downtown Boston. It's called We Are Boston, sponsored by the Greater Libertarian Party here in Boston. Go out there, support. It's going to be Monday, July the 5th at 3 o'clock. It's called the We Are Boston Rally. Come out here, see us. There's going to be several other event people there. Several other candidates ready for us. Come out and support us, support me, support the organization. Come out. It's called the We Are Boston Rally, July the 5th at 3 o'clock at Boston Commons. Okay, so this is a Queen Battle First Aid Responder Service coming live from downtown Boston here of Monday, June the 28th. God bless you, your family, and your loved ones. The pandemic is still not over for a lot of people. Go out there, do what you can, do what's best for you and your family, loved ones. Get the vaccine. If you don't get the vaccine, like I said before, talk to a healthcare practitioner and do what's best for you and your family and your loved ones. Okay, God bless you, your family, and your loved ones this season. As the economy opens back up, I would encourage you guys out there to speak to your local legislators to say your experiences of what you dealt with during this pandemic and how it applies to you. Talk to people, talk about it, what you've experienced during this pandemic, the isolation or social isolation, as well as just recovering, coming out and surviving this COVID-19 pandemic. So surviving it. So I would encourage you guys to go out there and take care of you, your family, and your loved ones. Okay. So this is the Queen Battle, a Battle First Aid Responder Services coming live from Staples Studio in downtown Boston, Massachusetts. I love you guys. Take care of yourself and your family, loved ones. God bless. Bye.